Well, I want to talk about two very important areas. One is something that is extremely important to nephrologists who are practicing. And of course, our medical directors, to a great extent, have a large fraction of the patients who are served in our facilities. So the medical directors really serve two roles, both administrative and as the attending nephrologists. We also have about over 4,000 nephrologists who practice in the facilities. And what's of great concern to all nephrologists is their ability to be autonomous. So they don't want somebody in Denver telling them how to practice medicine. And this is a very important part of the philosophy of how we operate on the clinical side of DaVita. We have a whole variety of tools, algorithms, protocols, and other tools to help nephrologists manage patients. But none of these is mandatory. None of these is required. What we tell our nephrologists is we want to help you deliver the highest quality care. To the extent you need our tools, we want to provide them. If you don't need the tools and you can drive your own great outcomes, then that's fabulous, and we want to support you doing that. So first, it's just a question of philosophy, which I think is different from other companies in terms of how we view the role of the doctor and our role as the corporate medical leadership. Secondly, from a business point of view, DaVita now has over 400 joint ventures with nephrologists, and we believe it's very important to give nephrologists an opportunity to participate in the business side of running a dialysis program. Not only is that an income opportunity for practice, but it also gives the nephrologist a little different perspective on how to drive great outcomes, but to do it in the most efficient way possible. That's not the usual way doctors think about things, and it's certainly not something you learn in medical school or in your training, but particularly nowadays with the tremendous budget pressures for the federal government and the fact that the ESRD program is largely a publicly funded program, it's critical that nephrologists are not only cognizant but good stewards of this public trust. And when we have joint ventures, I think that's a great way to emphasize that and to really get efficiencies.